As Dr. Tolaney said, data from the NATALEE trial has inspired hope that a new CDK4/6 inhibitor will soon be available for patients with early estrogen receptor positive breast cancer. If you want to learn more about how CDK4/6 inhibitors work, check out our video linked below. Dr. Aditya Bardia is a former Komen grantee and one of the NATALEE trial leads. We asked him about this trial and what it could mean for patients.
The NATALEE trial looked at adjuvant ribociclib, which is a CDK4/6 inhibitor for patients with stage 2, stage 3 breast cancer. The goal of therapy in the adjuvant setting is to prevent recurrence and cure patients from the disease, breast cancer being the case in this circumstance. And we've seen very impressive results with ribociclib in the metastatic setting, where it has shown improvement in overall survival for patients with metastatic ER-positive breast cancer, with letrozole, with fulvestrant, both premenopausal, both postmenopausal setting. So the question was, can we use this effective drug in early breast cancer to prevent disease recurrence and increase the proportion of patients who have cure? So NATALEE looked at ribociclib plus endocrine therapy in the adjuvant setting.
The initial results of the trial were positive. Researchers found that 90.4% of patients taking ribociclib were recurrence-free after 3 years, compared to 87.1% of patients taking endocrine therapy alone. This translates into a 25.2% reduction in risk of recurrence. The most recent data from the NATALEE trial were just presented at the 2024 American Society of Clinical Oncology meeting. One aspect of the NATALEE trial that set it apart from the monarchE trial, which we mentioned earlier, was that it included a wider range of patients. Patients whose breast cancer was node negative were included in the NATALEE trial, and these patients were not currently eligible to receive abemaciclib for early breast cancer. The data just presented at ASCO showed that even patients with negative lymph nodes benefited from ribociclib, meaning that a new option may be on the way for these patients. However, with new treatments comes the risk of added side effects and financial toxicity. We asked Dr. Bardia about how patients can weigh the risks and the benefits.
Absolutely. I think everything is a risk-benefit ratio, and we need patient-centered discussion, talking about the benefit with the addition of ribociclib, and then potential downside, which would be adverse events. Ribociclib can cause increase in liver enzymes, so it's important to monitor that with blood test. It can decrease white blood cells, so monitoring with the routine complete blood profile is important as well. And then finally, this drug has a unique side effect. It's not very common, but a unique side effect of QTc prolongation, which is with an electrocardiogram, but something that's seen in the first 2 cycles. So when ribociclib is prescribed, usually physicians get an EKG in the first 2 cycles. The incidence is about 1% or so. It's not very common, but something to be aware of.